Uganda's medical training sector has expanded rapidly. We now have 14 medical schools across the country, pumping thousands of young, eager interns into the healthcare pipeline every single year. But as the volume of new doctors surges, the system meant to support them is cracking. The government's traditional financial compensation model for these fresh graduates is effectively collapsing. The reaction on the ground is pure frustration. Dr. Mirambe Joel warned that junior doctors cannot work effectively without pay for a full year. He argues that when you have hungry, frustrated doctors on the wards, the patients are the ones who ultimately pay the price. Comparing models. Historically, a 5-year degree led to a paid internship, earning 2.4 million shillings monthly. The proposed path extends schooling to 6 years with an unpaid or slashed internship. The financial gap is massive, losing 1 year's earnings while self-funding another. Given these severe financial cuts and timeline extensions, you have to ask yourself a hard question. Is the massive investment required to become a licensed doctor in Uganda actually still worth it? To survive this systemic shift, we have to strip away the emotion of the strikes and the protests. We need to treat a medical career exactly like what it is now, an investment that requires a strict calculation of its return. The first major hurdle in this new pipeline is the proposal to integrate the internship into a mandatory 6th academic year. This replaces a paid workforce deployment with another full year of schooling. The government's rationale is straightforward. They have a budget deficit and need to save state funds. Meanwhile, the Uganda Medical Association has fiercely rejected the policy, arguing it places an impossible burden on young doctors. The immediate trade-off is clear. This move successfully reduces the state's financial burden, but it shifts the debt and the cost of living squarely onto your shoulders. If you bypass the academic extension, you still must navigate the reality of securing an internship slot. You must make it onto the Ministry of Health deployment list and get assigned to a clinical setting like Mulago National Specialized Hospital. Getting on that list is just the first step. To legally touch a patient, you must pay a provisional registration fee of 50,000 Ugandan shillings to the Uganda Medical and Dental Practitioners Council. Once deployed, you are expected to work a highly demanding schedule for a full year on the newly cut allowance of 1 million shillings, roughly $250 a month. There is a serious upside to this grueling year. You acquire vital, high-volume, hands-on clinical practice and build exceptional professional resilience. The sheer patient volume makes you an incredibly capable doctor. But while the clinical skills you gain are world-class, combining upfront regulatory fees with drastically slashed allowances creates a massive risk of financial frustration and severe burnout during your most critical transition year. There is an alternative route into Uganda's clinical ecosystem: international medical students flying in for short-term electives. This route requires heavy upfront personal capital. Visiting students have to self-fund their private travel, secure mandatory vaccinations like yellow fever, and purchase comprehensive medical and travel insurance out of pocket. They also face their own regulatory bottlenecks. The UMDPC requires foreign trainees seeking temporary registration to pay fees ranging from $200 to $400. That comes with strict documentation requirements, including submitting a certificate of current professional status to prove they are in good standing. The outcome for these students is a guaranteed clinical placement and high-value exposure to tropical medicine. Most importantly, their entire experience is completely independent of the Ugandan government's payroll. The foreign elective system highlights a stark reality about Uganda's current clinical training environment. It heavily rewards those who arrive with strong external financial buffers, allowing them to bypass the local compensation crisis entirely. Once you survive the internship year on the local path, you reach the final threshold: applying for full registration. You'll need original signed completion forms from key medical departments, and you'll have to pay 200,000 shillings to cover both your full registration and your first annual practicing license. Maintaining that license has an ongoing cost. You are required to accumulate at least 48 continuous professional development points every single year just to stay active. Here is the major return on your investment. This license gives you the full legal status required to open and supervise your own private health units. However, the UMDPC places a critical regulatory constraint on doctors attempting to scale their private practice income. Looking at the requirements for a supervising doctor, the council strictly limits how many clinics you can operate. To maintain quality control, one doctor is allowed to supervise a maximum of 2 health units in a given calendar year. While full licensure finally unlocks real earning potential in the private sector, the strict UMDPC compliance rules deliberately cap how much passive, scalable income a single doctor can generate. Uganda's clinical experience remains unparalleled, offering hands-on training you simply cannot find anywhere else. But the systemic financial padding that used to support young doctors through that training has been completely removed. This chart, the Scenario Match Matrix, maps your financial buffer against your career timeline. The ideal fit, in the top right, are trainees with high external financial support who can absorb years of unfunded training to reach profitable private clinic ownership. Conversely, the high-risk profile in the bottom left are debt-burdened trainees requiring immediate compensation upon graduation. If you fall into this high-risk group, the hard truth is that assuming a comfortable transition fueled by government allowances is a dead strategy. The days of a state-funded medical career are over. This path now requires you to act as your own benefactor, funding a long training period to reach the private sector rewards at the end. Your financial planning is now as critical as your medical studies.